So you and I are aware that for people diagnosed with schizophrenia, they are likely to experience acute episodes, times of crisis. How should we inform caregivers of what to do in the moment?
I think the first thing that a caregiver can do is at the time of diagnosis, and that may indeed be the first acute episode that the person that they care for and love is first time they're experiencing, and at time of diagnosis. It is essential at that time not only to educate yourself, understand the care plan, understand the members of the team and who to contact for what, plan for a crisis. I think we all would like to think, oh, after we get through this acute crisis, then there'll be stabilization, and then maybe we'll never have an acute crisis again. And more often than not, in fact, almost always, there will be another acute crisis. And so the best thing that you can do is to be prepared. And so what does that mean? That's just to go ahead and develop an emergency plan, know who to call if in fact you are to call a member on your loved person's mental health care team, or if you call local emergency services. It is critical that you know what to do. And I encourage caregivers and persons with schizophrenia together to have that plan of care, and so that there's an understanding. And so you may have it digitally, but I'm a little old-fashioned in that I suggest that you have it either written out or, whether you've typed it up and you print it out and have it in a visible spot, in the home, sort of a go-to spot, so that if something, all of a sudden happens and you find the person that you care so much about in an acute crisis, you may find yourself feeling a little disorganized and not really knowing what to do. So if you've already done that work ahead of time, you just have to remember where to go to find it and to know, okay, what do I do when? And I think that it's important to go back to that as caregivers, we can be that conduit of information when the person we care so much about may not be able to communicate what's happening, or may not understand, may not have insight, might not even be aware of really what they're experiencing. And so that when there is a response and say, you have to call emergency services and have a response team come, I would encourage you also to possibly, make a few calls ahead of time at the time of diagnosis to understand what those teams are comprised of. Is there a mental health responder on the team, someone who's trained in a mental health response? That would be great. But when they arrive to your home, your apartment, wherever it is that you are, it's important that you communicate for the person you're caring for and give them pertinent information. This is so-and-so and their age so-and-so. They were diagnosed with schizophrenia, whatever that time period was. They are not violent, or if that is the case, or they typically don't do X, and this is what I've been experiencing with them, and this is why I'm calling for your help. And when you call for help and someone comes and responds, then that's their job to then take care of your loved one. But any info you can provide at that time is very helpful. And any information you can provide as far as the safety of the environment is a plus as well. you know, if there are firearms in the home or if there are not firearms in the home and if they've been removed. And I don't mean to equate an acute crisis with violence, but when the individuals are coming into your home, you want to give them everything they know, because what they're focused on and what we're focused on in this moment, and that's the reason you made the call, is you're concerned about your loved one's safety. So anything that you can, any information you can provide is very helpful.
You know, I think that's very important. I love your points about the plan. Again, in times of I will say less crisis or non-acute times is a good time to make the plan.
Absolutely.
And I am very excited, as I'm sure you are, about 988 coming online. It's been about 3 or 4 years now.
Yes.
We've been fighting for that for so long because, you know, oftentimes there was a 10-digit number that people had to call. And in crises, medical crises, health crises, we knew 911.
Yes.
And it's been so wonderful that now it's 988. And also that's an information line. So you talked about calling that line perhaps for resources earlier, but it's also a line those folks are trained and they will quickly get to whether or not this is a crisis situation. So very important information and certainly great progress in our country on the 988
Yes,
line.
It can be a lifeline.
That's
It
right.
is a lifeline.
That's right.
So, good.
Oh, thank you.